The state's first measles case of 2025 has been reported in our area. There are normally a few per year, but because of falling vaccine rates and a nearby outbreak, health experts say this case could be different. Rachel Hanley explains.
They're adults, they're unvaccinated, and they recently traveled abroad. That's all we know about a measles patient in the New Orleans area, but doctors are paying close attention.
This is really a health emergency.
WWL Chief Medical Correspondent Dr. Corey Hebert says this case is notable for two reasons. For one, fewer people are getting their kids vaccinated than they used to.
The more people don't get vaccinated, the easier it is for one case to spread very quickly. And that's what we're very concerned about.
Hebert blames vaccine misinformation. Because measles can be especially dangerous to children and the elderly, he's urging anyone who's ever turned down the measles, mumps, and rubella vaccine to reconsider.
As parents, as caregivers, we have to make some decisions. Do you continue to believe hoaxes and believe conspiracy theories, or do you believe the science and get your child vaccinated?
There's also the outbreak in Texas. More than 500 cases have been reported there just this year. Measles is one of the most contagious diseases on Earth. That's why Hebert worries about the Louisiana patient.
If this person happened to be at the mall, if this person happened to be at a church service, if this person had happened to be in a situation where they were surrounded by a lot of people, then a lot of people are going to start getting this very contagious disease.
Louisiana lawmakers addressed the case Saturday. In a statement, State Speaker of the House Philip de Villiers said he spoke with the health department and, quote, was reassured that preparations had been taken ahead of the outbreak in Texas and that our Department of Health partners were ready for this possibility. Our state also deals with the occasional case anyway. Last year, there were 3 confirmed cases of measles in Louisiana. All 3 of them were here in the greater New Orleans area, and all 3 were related to travel. So far, this year's New Orleans area case is the only one in the state. Rachel Hanley, WWL, Louisiana.
The National Foundation for Infectious Diseases says about 1 in 5 unvaccinated people in the U.S. who get measles will be hospitalized. 1 out of every 1,000 will develop brain swelling, which could lead to brain damage. And between 1 and 3 out of 1,000 people will die, even with the best care. The symptoms include high fever, cough, runny nose, along with red and watery eyes. Then about 2 to 3 days after symptoms start, little white spots can form inside the mouth and patients may develop a rash. But there are ways that you can protect yourself from measles. For kids, there are 2 shots recommended, one at 6 months and another between ages 4 and 6. If your kid is between those ages, there is a booster, but that would mean that your child would get 3 shots total. For adults, if you were born after 1957, chances are you're already vaccinated with both doses. But if you think you're not or you lost your vaccination records, you can take a test and then there's a booster available. If you were born before 1957, you probably had it as a child, which gives you natural immunity, and you can talk to your doctor about a booster if you're interested.